Hello everyone. Today we are going to discuss about Blepharitis. What is Blepharitis? Causes of Blepharitis, risk factor and causes, sign and symptom, diagnostic evaluation, and finally we are talk about the treatment. Alright. So let's begin. First, we have the introduction. Blepharitis is the inflammation or infection of the eyelid margin. Alright. So blepharitis is the inflammation or infection. Blepharitis is inflammation होना और infection होना of the eyelid margin. Where there is your eyelid margin, near of the eyelid margin, there is a inflammation or inflammation due to the infection. Blepharitis is one Blepharitis is one of the most common ophthalmological complication as well as one of the most difficult condition to treat. Okay, so blepharitis is one of the most common ophthalmological complication. It is the most one of the most complicated ophthalmological condition as well as one of the most difficult condition to treat. It is also one of the most difficult condition to treat in the medical sector. Alright. सो ये सबसे कॉम्प्लिकेटेड कंडीशन होती है, मोस्ट कॉमन होती है और एज वेल एज मोस्ट डिफिकल्ट होती है इसको ट्रीट करने के लिए. नेक्स्ट ब्लेफराइटिस. Blepharitis is common eyelid inflammation that sometimes is associated with bacterial eye infections, symptoms of dry eye, or certain type of the skin conditions such as acne, rosacea. Alright, so blepharitis is common eyelid inflammation. It is a common eyelid inflammation of the eyelid that sometimes is associated with the bacterial eye infection. Sometimes it is associated with bacterial eye infection, symptoms of dry eyes, or certain type of the skin conditions such as acne, rosacea. Okay, so it is associated with bacterial eye infection. It is associated with bacterial eye infection, symptoms of like dry eyes or certain type of the skin conditions such as acne, rosacea. Blepharitis is one of the most frequently observed condition among eye care practitioners. It remains largely misunderstood. Okay, so blepharitis is one of the most frequent. It is the one of the most frequent observed condition among eye care practitioner. आई केयर प्रैक्टिशनर जो होते हैं अक्सर ये मोस्ट अक्सर ज़्यादातर ये देखने को मिलती है, बहुत समय पर बहुत पेशेंट होते हैं जिनको देखने को मिलती है. इट रिमेन लार्जली मिसअंडरस्टूड और बहुत अभी भी इससे बहुत सारे लोग हैं वो इससे रिमेन मिसअंडरस्टैंडिंग है, इसके बारे में प्रॉपर उनको नॉलेज नहीं है. दे डिडंट हैव द प्रॉपर नॉलेज. स्लिट लैम्प बायोमाइक्रोस्कोपी, अब ये टेस्ट होता है. The slit lamp biomicroscope is an important diagnostic instrument for the examination of the anterior eye structure as well as the contact lens. Being able to proficiently use the instrument is important. It use critical in the fitting of the contact lenses. Got it? So the slit lamp microscope is an important diagnostic instrument. It is an important diagnostic instrument for the examination of the anterior eye structure. Anterior eye का structure का diagnose करने के लिए, examine करने के लिए, this is the most important diagnostic instrument of the anterior eye structure as well as the contact lens. Contact lens का और anterior eye का examine करने के लिए this is the most important instrument. Okay, so being able to proficiently use the instrument is important. It use critical in the fitting of contact lenses. Being able to proficiently use the instrument is important. इसको properly use करना, being able to proficiently use the instrument is important. It use critical in the fitting of contact lenses. It is critical in the fitting of contact lenses. Contact lens fit करने में maybe it might be critical to use, but it is the important diagnostic instrument for examination anterior structure of the eye as well as the contact lens. Would it? Now we are talk about the classification. We will discuss blepharitis according to its predominant anatomical location as anterior and posterior. We are talk about upon on the anterior and posterior as per condition, as for the infection. First we have the chronic marginal blepharitis. This is the anterior, and next one is the posterior. Anterior, staphylococcus सेवोरुइक। नेक्स्ट है फर्स्ट स्टेफाइलोकोकस की वजह से आपको होना, सेवोरुइक की वजह से आपको होना। नेक्स्ट सेकंड वन इज द पोस्टीरियर, पोस्टीरियर इज द मीबोमियानिटाइटिस, मीबोमियानिटाइटिस, मीबोमियन सेबोरियो, राइट। सो देयर आर दी एंटीरियर जो होता है स्टेफाइलोकोकस पैथोजेंस की वजह से, सेवो सेबोरोइक पैथोजन की वजह से, पोस्टीरियर जो होता है मियो मियनिट्स की वजह से, एंड मियो मियन सेबोरियो की वजह से आपके हो सकता है, राइट। नेक्स्ट एंटीरियर ब्लेफराइटिस। Anterior blepharitis is characterized by inflammation at the base of the eyelashes. बेस ऑफ आईलेसिस में आपका इन्फ्लेमेशन होना, स्वेलिंग होना, दिस इज कॉल्ड द एंटीरियर ब्लेफराइटिस। पेशेंट विद एंटीरियर ब्लेफराइटिस कंपेयर टू दोज विद द पोस्टीरियर ब्लेफराइटिस आर मोर लाइकली टू बी फीमेल एंड यंगर। ओके, so patient anterior blepharitis compared to those with posterior blepharitis are more likely to be female or younger. पोस्टेरियर में अक्सर देखा जाता है तो दे आर दी फीमेल एंड मोर यंगर पेशेंट को पोस्टेरियर होता है। अक्सर जो विथ एंटेरियर होता है उनको उनके कंपैरिजन में। गुड। नेक्स्ट, टू वेरिएंट ऑफ द एंटेरियर blepharitis are identified. There are two variant of anterior blepharitis are identified. First is staphylococcus and seborrheic, seborrheic, right? Seborrheic or staphylococcus. There are the two variant that cause blepharitis. First the staphylococcal, second is the seborrheic. In staphylococcal anterior blepharitis, colonization of the eyelids by the staphylococci lead to formation of the fibrinous scale and crust around the eyelashes. Okay, so staphylococcus anterior blepharitis, this is the colonization of the eyelid by staphylococcus, colonization होना आपके eyelids में by the staphylococci के through, it lead to the formation of fibrinous scale. ये फर्दर लीड करता है आपका फॉर्मेशन ऑफ द फाइब्रोनियस स्केल एंड क्रस्ट अराउंड द आईलिड, आईलिड्स के अराउंड में आपका फाइब्रोनियस स्केल का फॉर्मेशन करना एंड क्रस्ट का फॉर्मेशन करना अराउंड द आईलेसेस। एंड सेबोरिक वेरिएंट जो होता है इट इज कैरेक्टराइज्ड बाय द डैंड्रफ लाइक स्किन, डैंड्रफ लाइक स्किन हो रहा एंड डैंड्रफ लाइक स्किन चेंज अराउंड द बेस ऑफ आईलिड, बेस ऑफ आईलिड के अराउंड में आपका डेंड्रफ लाइक स्किन में आपका चेंजेस होना, रिजल्टिंग इन द ग्रेसी स्केल अराउंड द आईलेसेस, आईलेसेस के अराउंड पर आपका जो है ग्रेसी स्केल का आपका फॉर्मेशन होना। Now we are talk about the pathophysiology. Okay, the pathophysiology of the blepharitis is not completely understood. A role of lead colonization staphylococcal bacteria was the first noted in 1946. Several mechanisms by which staphylococci may after meibomian glands secretion and cause blepharitis are the supported by the many studies. Okay, so there is the no exact there is no exact completely cause what is the reason behind that, we didn't understood. एंड रोल ऑफ आईलिड स्टेफाइलोकोकस बैक्टीरिया का समटाइम रोल हो सकता है। इसको जो फर्स्ट नोटिस किया था, फर्स्ट इसको देखा गया वो नोटेड इन दी 1946 में। देयर आर दी सेवरल मैकेनिज्म आपके हो सकते हैं, स्टेफाइलोकोकल हो सकता है मे आफ्टर दी मियोवियन ग्लैंड का सिक्रेशन होने की वजह से ब्लेफराइटिस आपका हो सकता है। मैनी स्टडीज इसको सपोर्ट करती है, मैनी स्टडीज के सपोर्टिव में बात करती है, राइट। नेक्स्ट है डायरेक्ट इन्फेक्शन ऑफ द आईलिड। आईलिड्स का आपका डायरेक्ट इन्फेक्शन होने की वजह से इवोक रिएक्शन टू स्टेफाइलोकोकल एक्सोटोसिन की वजह से हो सकता है। प्रोवोक एलर्जिक रिस्पॉन्स टू स्टेफाइलोकोकस एंटीजन की वजह से हो सकता है। नेक्स्ट है इट इज लाइकली that a combination of these responsible for the clinical manifestation of the staphylococcus blepharitis. So it is likely that combination of these all are responsible for the clinical manifestation of staphylococcus and blepharitis. Got it? So next, move ahead. Next clinical presentation like symptoms. First is the burning, grittiness and mild photophobia with the remissions and exacerbation is characteristics, right. Symptoms are usually worse in morning, although in the patient with dry eye they may increase during the day. Okay, so symptoms are usually worse in the morning. Symptoms are usually worse in the time of the morning, although in a patient with dry eye they may increase during the day. ड्राई आई का जो सिम्टम है दे मे इंक्रीज ड्यूरिंग द डे. गुड इट. साइन इज द स्टेफाइलोकोकल ब्लेफराइटिस. Hard scale and crushing mainly located around the bases of the laces, especially colerate. Colerate. Okay. So hard scale and crushing mainly located around the bases of the laces, especially correlate. Col- रीट. ओके, सो देर इज दी हार्ड स्केल का आपका फॉर्मेशन होना, क्रस्टिंग का आपका फॉर्मेशन होना, मेनली लोकेटेड अराउंड द बेसिस ऑफ द लेसिस. लेसिस के बेसिस पर होना, बेस जो होता है लेस का वहां पर होना, स्पेशली कोले कोलो रीट के पास में होना. नेक्स्ट है क्रोनिक कंजक्टिवाइटल हाइपर hyperemia with a mild papillary conjunctivitis. Okay, so chronic conjunctivital hyperemia with a mild papillary conjunctivitis. Chronic conjunctivital hyperemia with mild papillary conjunctivitis भी देखने को इसमें मिल जाता है. This is the another sign and symptom like that you can see here. Next is scarring and notching. Notching means tylosis of the lid margin. Trichiasis means कि misdirected eyelashes. Madarosis means कि loss of lashes, और poliosis means loss of pigmentation of the lashes, and in severe long standing cases. So there are the another sign and symptom like that. Okay, change the color of the laces and losses of the laces sometime. This is the sign and symptom. Secondary change include, this is the primary. Next secondary change include stay formation. Stipe formation होना, marginal keratitis and occasionally phenylnectinosis means the corneal nodule scent develop near the limbus and then spread into the cornea, carrying behind them a lace or basals. ओके, सो मार्जिनल आपका कैरेटाइटिस होना, इन्फ्लेमेशन होना, मार्जिनल कैरेटाइटिस होना, ओकेजनली कभी कभी ये फ्लेक्टोन्यूलोसिस भी हो सकता है. दिस इज द कॉर्नियल नोड्यूल सेंट develop near the limbus and then spread into the cornea, carrying behind them a lens of vessels. Next, associated with the tear film instability and dry eye. Okay, next is the associated with the tear. Associated with tear, tear के साथ आपका associated होना, film instability and the dry eyes आपका होना. Next, the diagnosis. The diagnosis of the blepharitis is the clinical based on patient history and the physical examination finding. There are no confirmatory diagnosis test or laboratory investigation. Okay, so the diagnosis of blepharitis is a clinical. The diagnosis of blepharitis is a clinical based on the patient history and physical examination finding. There is the no confirmatory diagnosis. There is no confirmatory confirmed diagnosis. There is no exact diagnosis, test or laboratory investigation. The history should be include about question about the symptom duration, smoking, allergens, contact lenses, and use of the retinoids, which may provoke the exacerbate symptom. A history of acne, rosacea, eczema, and should be evaluated. Correct. There is no exact diagnosis. We can observe it, we can analyze it upon the symptoms. What is the symptom is there, as per symptom we can close the diagnosis, we can nearby the diagnosis. Okay, so it's look like that. You can see here an examination of the tear film. We have to examination of the tear film. Bubbles, also called fruiting, can sometimes be seen in the tear film, especially along the lid margin. This can indicate meibomians. Okay, like this. The laces should be examined for the abnormalities such as blepharitis. Which blepharitis? There will be a collarettes found at the base of the laces. नेक्स्ट है वर्निंग होना, फ्लैकिंग होना, क्रस्टिंग होना, टीयरिंग होना, इरिटेशन होना, इचिंग होना, रेडनेस होना, फॉरेन बॉडी सेंसेशन होना, एंड वल्वर एंड पाल्पेरल हाइपरमिया होना. करेक्ट. Treatment of blepharitis: anterior blepharitis, staphylococcal blepharitis, more severe loss of eyelashes, eyelids, cleaning and hygiene, antibiotic ointment for the eyelids, viruses and other type of the bacteria. Beside staphylococcus also can cause anterior blepharitis. Next is seborrheic blepharitis, seborrheic dermatitis, regular cleaning with the eyelid, scrub and the gentle non-detergent shampoos. Got it? Without treatment, blepharitis caused by the bacteria can cause long-term effects such as ectropion, thickened lid margin, dilated and basal capillaries, trichiasis, and entropion. In case of the trichiasis and entropion, the cornea may exhibit significant erosion from the eyelashes rubbing against the eye. Next, eyelid hygiene reveal blepharitis symptoms. Okay. Blepharitis can be difficult to manage because it's often chronic, meaning that is form compress goes away completely your eyes. Doctor may be recommended one or more of these steps involving good eyelid hygiene and manage. Apply a such as a wash cloth to the outer eyelids. Cleanse the eyelid with a commercial lid scrub or other recommended product. Gently massage outer eyes. A warm compression loosen the crust of your eyelids and eyelashes before you clean them. The warmth also can loosen any blocked residue in oil secreting meibomian gland in your eyelids. Got it? According to recent study, people with the blepharitis are more likely to have certain inflammation diseases psychological issue, cardiovascular disease, and more. So thank you for watching this. I hope you got it everything. Now let's quickly sum up. We are talk about the blepharitis. What is the blepharitis? Classification of blepharitis, sign and symptom of blepharitis, diagnosis of blepharitis, management of blepharitis, causes of blepharitis. There is the no exact pathological causes of blepharitis. What is but we can analyze as per symptom, as per the history collection, as per correlate with the previous diseases, and we can near of the diagnosis. So now here we can see the anterior and posterior classification is the anterior and posterior. After that we see the definition. Blepharitis is the common eyelid inflammation that is sometimes associated with the bacterial eye infection, symptom of dry eyes or certain skin conditions such as acne, rosacea. Blepharitis is the one of the most frequently observed condition among eye care practitioners. It remains largely misunderstood. Okay. Slit lamp biomicroscope is there, and next one is the classification: anterior and posterior marginal, anterior blepharitis, posterior blepharitis. We can see here, we can see pathology, and after that we seen presentation symptoms, sign and symptoms. Okay, so I hope you got it. If you have any doubt regarding this, you may ask. Thank you for watching this. Bye bye, have a great day.